Let's talk about some male reproductive physiology. I think these pictures pretty much sum up everything we need to know about it. Mullets, little dick trucks, boobs, and letting the little head do the thinking for the big head. I think that's pretty much all you need to know about males. By the way, that's my friend Vicky who gave me permission to use this photo. She's now a nurse. So she was in my class back in 2006. She's been a nurse for a while. Still in touch with Vicky. She's awesome. Got married, got a little kid. She's fantastic. So male reproductive anatomy. The left testis hangs lower than the right in about 50% of men. Apparently, like in about a quarter, they hang the same, and in a quarter, the right one hangs lower. I don't know. I've seen that several places. I can't confirm that's definitely true. There have been times at the gym, in the shower, when I've thought of saying, let's see, excuse me, are you left-handed by any chance? But I don't know. I don't want to get my ass kicked in the shower at the gym, so I would never say anything like that. So the testes are separated by the median septum, all right? There is a divider. Remember septum like the nasal septum? Just a divider between the two, like the interventricular septum, the interatrial septum. Septum means divider. So the spermatic cord contains the vas deferens or ductus deferens, both terms get used, which consists of blood vessels and nerves, all right? So the spermatic cord has, along with it then, it has the vas deferens, blood vessels, and nerves. That's fine. That's good enough. The cremaster muscle consists of strips of the internal abdominal oblique that envelop the spermatic cord. So in other words, they are extensions of the internal abdominal oblique. They come down through the opening through which the testes descend, and they surround the entire spermatic cord. And the purpose of the cremaster muscle is to raise and lower the testes, and we'll talk more about that in just a moment here. There's also the dartos muscle, which contracts with cold and shrinks the scrotum. The dartos lines the inside of the scrotum. It also has the same purpose as the cremaster muscle. Both together can raise and lower the testes to pretty exact levels. The pampiniform plexus is a network of veins that use countercurrent exchange to keep the testes cooler. So all three of these mechanisms together, the cremaster muscle, the dartos muscle, the pampiniform plexus, their job is to ensure that the testes try to stay 2 degrees centigrade cooler than the body, which is necessary for sperm production. Remember before I mentioned that sometimes the testes don't descend in males, called cryptorchidism? Well, see, those males will be sterile because the testes can't produce sperm if they're up inside the body. That's why they have to hang lower. That's why the boys have to dangle down. They need to stay cool in order to do the sperm production. If you watch males, right, if you see naked males getting out of, like, a lake, just look out of the corner of your eye. You can see that the scrotum is often shriveled up as they come out of the cold water, and once they get back to normal temperature, then the boys will hang down again. So it's all about sperm production and basically keeping the testes either warm or cold, either raising or lowering. Raising to get them warmer, lowering to keep them cooler, all right? The word testis, by the way, like I mentioned before, means witness in Latin. So testis, that's the word testify, comes from that. If you claim to be a man, the testes are your witnesses. You can testify with your testes. They will be your witnesses. Okay, so skin is loosely attached to the penis to allow erection. That's why the skin over the penis, when it's not erect, is wrinkly, all right? Then the glans is the very end of the penis, all right? The little fireman there. The little fireman is called the glans. It's smooth skin. And then the skin that covered is called the prepuce. The common name is foreskin. The more technical name is the prepuce. Just a little flap of loose skin that covers the glans of the penis. The penis consists of 2 different kinds of tissue. In the lower left, you can see those. The corpus spongiosum is the most ventral, and the corpus cavernosum, singular, or corpus cavernosa, there are 2 of them side by side. those are all erectile tissues. So they can engorge with blood to cause erection. There's not, even though it's called a boner, there's no actual bone. Although there is in a lot of other mammals. All the aquatic mammals have a penis bone. So do, I know all the procyonids do, the raccoons and things like that. So penis bones do occur in a variety of male mammals, but not in male humans. It's all just blood. And then the urethra passes through the corpus spongiosum. All right. So notice there are 3 compartments of erectile tissue. And if you look closely at an erect penis, which I'm not saying you should or shouldn't, I'm just saying if you ever do, you can actually see that there really are 3 compartments of tissue. You can certainly at least see that the corpus spongiosum is its own separate tissue compartment from the 2 corpora cavernosa. All right, and then continuing here with the testis, that's enclosed in the tunica albuginea, which literally means the white shirt. Tunica is a long shirt, like worn by knights under their armor. So it's kind of a long shirt that goes down over your waist. And albu, that like albumin, means white. All right. So tunica albuginea is the white shirt. That is tissue that encloses the testis. There's connective tissue that divides the testis into 250 to 300 lobules. So lobules, little lobes. So if you look at the illustration on the top there, you can see all the little lobules, all right? And each lobule has 1 to 3 seminiferous tubules, it's where the sperm is produced, okay? That's where sperm is actually manufactured. And between the seminiferous tubules are interstitial cells, used to be called the cells of Leydig, where testosterone is produced. So notice it's all happening right in the same area. Making testosterone, making sperm, they both go together, all right? The lumen of the seminiferous tubules has sustanacular, used to be called Sertoli cells, which produce inhibin. So in other words, sperm production is normally stimulated by testosterone, and when you've got enough, then inhibin says, okay, slow down. I think we can make babies now. We got plenty of the baby batter ready to go. So guys, just take 5. You don't need to make any more right now. There are tight junctions between the sustanacular cells forming the blood-testis barrier, the BTB, which keeps the immune system from attacking the sperm. So as we'll try to clarify in a moment, remember humans have 46 chromosomes, but the sperm and the egg only have 23 each. That's so that when they come together, they make a new, complete human with 46. Well, but think about it. Sperm have only 23 chromosomes, so to your immune system, they look like aliens. And your immune system says, kill them, kill them. So you have to have a blood-testis barrier that prevents the immune system from destroying all the sperm. Assuming you do want to make little parasites, that's what has to happen. And so the epididymis is kind of like that coiled tube. It's really just more seminiferous tubules that's coiled on top of the testis that can store sperm up to 2 months. So testosterone stimulates sperm production. Males are making sperm, and then you store it, because you never know when you're going to have a sperm emergency. You never know when you're going to need to make a little parasite right now. So you always keep some on hand in case you have one of those sperm emergencies, all right? The vas deferens extends from the epididymis and widens into an ampulla before it reaches the seminal vesicle. So you can see on the top of the illustration there, look at the ductus deferens or vas deferens coming off from the epididymis. It goes up to the ampulla, see, of the ductus deferens, all right? And then that joins with something called the seminal vesicle, all right? Remember, ampulla means like an ampule of a drug. Ampulla basically just means a wide spot in a tube. So the ampulla and the seminal vesicles join together to form the ejaculatory duct. So see where the seminal vesicle and the ampulla of the ductus deferens come together? They then enter the prostate gland and forming the ejaculatory duct. Now the seminal vesicles secrete a sticky yellowish fluid containing fructose, which constitutes roughly 60% of semen. That percent is just an approximate. You'll see different figures, different places. But, something. In other words, most of semen is what is ejaculated. Everybody says it's sperm, but really sperm is only part of it. The ejaculate is called semen, all right, and it's mostly seminal fluid. Now, why is it full of fructose? Well, the little swimmers need energy. They have to swim a long way to find that egg. And so they're going to need a lot of ATP, so there's a lot of fructose in there in order to give them the energy they need to swim. One semester, a girl in my class said, well, if there's so much fructose, then why does it taste so salty? And I said, thank you so much for that question. But I said, then you should know the answer to that. Think about it. Semen is extracellular fluid. What is the main ion of extracellular fluid? Sodium. So yes, most body fluids, sweat, tears, everything, semen, they have a slightly salty taste to them because there's a lot of sodium and a lot of chloride. The prostate gland produces a thin whitish fluid containing fibrinolysin that constitutes roughly 30% of semen. So a prostatic fluid is 30%. It liquefies semen roughly 15 minutes after ejaculation. By the way, so take a look here. Seminal fluid, roughly 60%. Prostate, roughly 30%. Again, these are just approximate numbers. Sperm, therefore, is only like 10% of semen, all right? It's the smallest component. Now, why would you want to liquefy the semen 15 minutes after ejaculation, all right? The fluid contains fibrinolysin. So you are programmed, basically, so that the semen will decompose after about 15 minutes. Why? Well, basically, you don't want old, tired, stale semen making their way to the egg. You only want the strongest and handsomest and, the real winners. You only want them to make it to the egg. So, by golly, if by 15 minutes they haven't got there, then look, let's just try again sometime. Let's get rid of these right now. They obviously weren't good enough. We'll try again at some point in the future. So, had a girl in my class one time say, oh, that explains it. I always wondered why, like 15 minutes after sex, everything just comes gushing out. I said, thank you so much for that visual. Then there are the bulbourethral glands that secrete a clear fluid that lubricates the penis and neutralizes the acid of the vagina. So look there, you can see at the base of the penis, there are the bulbourethral glands. Again, they secrete a lubricating fluid. Sometimes you'll see it informally referred to as pre-cum. So, and you'll have people asking, can I get pregnant from the pre-cum? Well, think about it. This is just a clear fluid, a lubricating fluid from the bulbourethral glands, all right? There's no sperm in them, all right? So technically, no, you can't get pregnant from the pre-cum. However, if you're going for round 2, all right, if you've already had sex once and you're going for seconds, then there could still be some sperm perhaps left somewhere in the duct, all right, in the spongy urethra. So when the bulbourethral glands secrete their lubricating fluid for the second time, there could possibly be some sperm in there. So that's probably why there's confusion about whether bulbourethral fluid can cause pregnancy. I mean, technically, no, it can't. But again, if, it's contaminated, so to speak, with sperm, then I suppose it could. All right? And, by the way, take a look here. Collection days are Monday and Thursday. All cancellations must be made by 9 a.m. Orders may be placed. Saturday deliveries, yeah. All semen is shipped via next-day air delivery. Volume and commercial semen contracts are available. Full price, August 28th. You're thinking, what kind of kinky thing is going on here? Actually, this is for bull semen. When I taught at a little college in Oklahoma, one of my students, his dad, drove like 500 miles to pick up a vial of bull semen. They breed down there. They're trying to, have championship cows that will win prizes. So bull semen is actually very expensive, and there's a huge actual market in it. And, you want that champion steer. Yeah, this girl's dad drove 500 miles each way to pick up a vial of bull semen to make his champion steer. All right, and then she's the one who said that she's now a neurologist. She's the one who said, always wonder why I came gushing out. She said, I always wanted to change position so I didn't have to sleep on the wet spot. I said thank you for all the visuals you are providing for my class. There she is again. We used to go hiking together. She's a former MMA fighter, so she's really in good shape, and she punches really hard. I used to make fun of her when we would go hiking. She would say, Tom, I was reading something the other day. And I said, really? You can read? And she would hit me. So she would leave like bruises on me. She would hit like the shoulder. So the next time I insulted her, I would stand on the other side. So she would hit my other shoulder. And one time after she'd hit me in both shoulders, both my shoulders were sore where she'd punched me. She hits really hard. I stood behind her the next time I insulted her, and she spun around and drove her fist into my sternum and gave me a bone bruise that lasted for weeks. Here I saw her one night after once she was in medical school. She didn't have time to go hiking anymore. So I saw her at a club one night and noticed we're talking. Hi, nice to see you. Look at her hand. Look at my hand. And there she is right there. We're still talking, having fun. Then I insulted her, and look at her hand now. See how she's making a fist? She's getting ready to hit me again. So, and yeah, I don't know why that's here. Okay, and there you have, so I was going to talk here about, there's a sexual transmitted disease. There is related to a parasite that also gets into the respiratory tracts of birds. All right. So it creates a vaginalis, a vaginitis, and there are two forms of it. There's it's trichomonas. There's Trichomonas gallinae and Trichomonas vaginalis. So normally one is only found in the vagina. That causes vaginal irritation. The other one is found in the respiratory tracts of birds. It can actually kill them. But the two can intermingle, and they can cause similar symptoms, each one to the other. And so sometimes when women come in and they've got Trichomonas vaginalis, they'll get treated for it, and they'll say, is your sexual partner having any symptoms that you've noticed? And they'll say, no, he or she, I've noticed has a little cough. And then they go, okay, all right, we want you to give these meds to your partner as well, because sometimes that Trichomonas vaginalis can find its way into the respiratory system. You think of how that might happen, and that's why they give the meds to the sexual partner as well. Insert a clove of garlic in the vagina and keep it in for as much time as possible. No, seriously, please don't do that. Okay. Where is sperm produced? The epididymis, the interstitial cells, the seminiferous tubules, the sustanacular cells, or the bulbourethral glands? That would be the seminiferous tubules, all right? And again, we're talking about male or reproductive anatomy and physiology here. Here's a really fun thing that guys get to do. This is called a digital rectal exam. So the prostate sits right at the base of the penis, in between the urinary bladder and the penis. And prostate cancer is one of the main cancers in males. So what happens is, during an annual physical, oftentimes the doctor hopefully will put on a pair of gloves first. I would personally insist on that. And then the doctor will insert a finger into the rectum. And the advantage here, medically, is that the rectum gives access to the prostate. And the doctor will palpate the prostate, just looking for the presence of nodules or something like that that might indicate prostate cancer. So proximity of prostate to rectum allows for the digital rectal exam to check for prostate cancer. There are also prostate-specific antigens, PSAs, in the blood that are also used to check for prostate cancer. Prostate is palpated to determine size, firmness, presence of nodules, etc. And prostate may be massaged and prostatic fluid collected. So the doctor may actually hold like a little cotton swab at the tip of the penis, and while palpating the prostate, cause the secretion of fluid, which can then be analyzed. I always tell my doctor before he does this that I need dinner and a movie first before anybody does this to me. And he says, well, we'll see if we can work it out. All right, so talking about sperm production here. Spermatozoon, singular, spermatozoa, plural, consists of a head, a midpiece, and a tail. You can see in the lower right there. So spermatogenesis begins at puberty. Thank God males aren't making sperm before puberty. Otherwise, the world would have ended long ago. It would have just dissolved into chaos. So thankfully, it's not until puberty that males start making sperm. The primordial germ cells differentiate into spermatogonia, which multiply by mitosis, producing type A and type B daughter cell spermatogonia. Now, why do you have to have two kinds? Okay, so the type A remain outside the blood-testis barrier and continue to divide throughout life. It's a scary thought, but males produce sperm throughout their entire lives. There's no real menopause for males. Unfortunately, 100-year-old guys are still making sperm and they can still have babies. That's a terrifying thought. But so the type A stay outside the blood-testis barrier, remember, so that they're not attacked by the immune system, and they continue to make sperm throughout your life. The type B divide by meiosis to produce haploid cells, all right? Those are the ones with only 23 chromosomes, all right? And then spermiogenesis is the final stage here. Notice in the bottom illustration on the far left, originally spermatogonia look like other cells. They're big and round and floppy, and they're kind of like more like rafts. Those wouldn't be very good at swimming. So you strip away a lot of the cytoplasm and stuff like that to make those sharp, virile, masculine-looking swimmers there on the far right with those pointed heads so they can puncture that egg. And those are the little swimmers that will go looking for the egg. Streamlined and athletic, look just like Michael Phelps, don't they? And, erection physiology, again, there's no bone in humans, all right? It's just blood. So what has to happen is blood vessels have to dilate and engorge with blood in order to cause erection. And that's what happened. You can see the diagram right there, the erect position versus the flaccid. So these blood vessels just, and they dilate, vasodilation, fill with blood, and that causes the penis to become erect. Now, sometimes for a variety of reasons, nervousness, age, and so on, males have difficulty getting an erection, erectile dysfunction. So what will happen here is they develop drugs in order to try to help that. So Viagra is the one that people probably most familiar with. Cialis, another one, all right. And what do you suppose these drugs do? What do you suppose they would do? Yeah, they basically just cause vasodilation. Originally, actually, these were drugs for blood pressure medications. They were high blood pressure meds, and they were going through their clinical trials. And, you always, observe signs and symptoms in any clinical trial. And so they were, asking these guys who were being given this drug for their high blood pressure, are you noticing any, signs, symptoms, whatever? And these guys were saying, yeah, I got a boner all day long. And they're thinking, we are marketing this to the wrong group, all right? So to hell with it. There were better drugs for blood pressure, so they just basically changed the package label and said, yeah, actually these are for erectile dysfunction. But Viagra was not the first name they came up with. There were several that they rejected along the way. This one, mycoxaflopin. There was also mycoxafalin, midixadrupin, midixarizin, midixadud, and ibuprofen.